Can anybody hear me?
Maybe type it in the list.
To go log in on another computer.
Yeah.
Check and see. And just remember you have a live microphone, okay?
Yeah.
Dr. Hunter.
And hello, good afternoon. I'm going to go ahead and get started. If someone else comes on, we'll rotate the presentation around. I'm Samuel Hunter. I assume you guys know me. We're going to talk today about new possibilities in NMS treatment. Yeah, Julie, you've raised your hand. Do you have a question?
No.
Okay. That's good. Well, I'm going to leave everybody unmuted so that if you have a question, please barge in and go ahead and talk. But this is just meant to be a brief sort of update. It's something we're trying periodically because everything's changing so quickly in MS treatment, just to help people know what's going on with MS. We're going to talk about newly approved medications, research, and some medications that are coming in the near future. The exciting thing is there is a lot going on with MS, and if you haven't heard about some of the recent events in new things to treat MS that have really changed what we're doing, this is what this session's about. It's also to tell people about some research opportunities we have that are really exciting. So this medicine, Limtrada, which is probably the biggest advance we've ever had in MS in terms of the ability to control the disease better, was formerly called Campath. It's a way to reboot the immune system. It's been extraordinarily successful. 25 years of research. It's only 8 IV treatments over 12 months, and then 5 years of safety monitoring for infrequent blood and kidney complications. There's a risk of your thyroid getting overactive, which is a temporary problem. It's been the best medication yet for actually improving people's disability. It's the only medication that reliably improves people in disability. And it's considered, however, because of the safety issues requiring monitoring, that it's sort of a backup plan for people with MS that's not responding to other medicines. Generally, a couple other tries of medications are what are recommended.
It's not showing.
Oh, it's not showing?
No.
Oh, let me go back here a little bit because the screen's not showing. So it's not change presenter to me. Okay.
There you go.
Now can people see me? Okay. All right. Now can you see the screen?
I see you, but I can't. Now, yes, now I see
Okay.
the screen. Yes.
All right. So let me put the picture behind. So people see the screen there on Limtrada now?
Yes.
All right. Wonderful. So anyhow, this Limtrada is a medicine that, we've treated around 125 people. I have a colleague who's down in Alabama has treated 500 people. It's basically completely changing difficult MS, and that people who used to have difficult MS don't have it anymore. They have milder MS, and it's a long-term benefit for just a short-term treatment. Most people don't get more than 8 infusions. Occasionally somebody gets an additional 3 after a year or 2. All right. The other medicine that's new was just approved, isn't available yet, called Zenbrenta. It's a medicine called Declizumab. It was formerly known as Xenopax. It is a different medication of treatment. It was more effective than Aminex in a trial. It had a lot of safety issues, which is going to make it a niche medication for people who can't really respond to other medications or take other medicines. It's a monthly injection. It's fairly well tolerated. It does, however, have a risk of liver injury that requires regular testing monthly before the injections. It has a risk of major skin inflammation, which ranges from serious to mild, and it has a risk of other autoimmune diseases, about 1%, and a significant risk of life-threatening infections. However, it doesn't have a PML risk, and this is felt to be a niche medication for people who can't take other ones. We have a research opportunity with a new medicine called ponesimod. It's an improved version of Gilenya-like medications. Nowadays in research trials, we often have research trials that no longer use inactive medications, so we're able to use treatments that everybody gets treated, and we just use one that's a comparison. And in this research trial, this Gilenya-like medicine is being tested against the actual marketed version of Aubagio. Both these treatments are already proven in research trials. Everyone gets treated. It's hard to tell which treatments you get because they're both such good medicines and have so little side effects. This is a great research trial. You get years of free treatment. They're low risk. They're well tolerated. We pay people for visits. People have to have relapses with their MS, but they can be progressive with relapses in the past. They either have to have had a relapse in the last year or a new MRI lesion that we can see on MRI. People up to 55 years old, no cancers previously, no prior treatment with Gilenya or Aubagio is who we're looking for. And there's another exciting new drug called monomethyl fumarate prodrug. It's an improved version of Tecfidera. A company that's called Alkermes has made this drug. It's a twice-a-day, well-tolerated drug that appears to be out with the tolerability problems of Tecfidera appear to be absent. It's a rare trial. It's that's supposed to be blinded, not blended, unblinded trial where everyone gets the same treatment. And the doctors can actually look at the MRI scan. So it's years of free treatment, payment for visits. The government was so impressed with the drug that they told them, just do this drug and do this trial without any comparisons, and you can get it approved. It looks like it has the efficacy of Tecfidera without the side effects. The unusual in that this trial will take older patients up to age 65 as long as they have no cancer or major GI problems. They're looking for people who have relapsing MS, and people don't have to have had a relapse recently. They cannot have done poorly with Tecfidera, though, in order to be in this trial. There's an opportunity for people who are on beta-seron and want to take beta-seron to participate in a small trial that's a data collection with the BetaConnect device. This is a really neat device that's an electronic injector that is infinitely adjustable for doing injections. It's for people who want to start or are already taking beta-seron. It's a very simple study. If someone is thinking about starting beta-seron or wants to get this injector, they can participate in this research study. We have a couple of very exciting research trials coming in a few months. One is with an anti-CD20 B-cell depleter, which is a monthly injection called ofatumumab. It's being tested against teriflunomide, which is the medicine that's called Aubagio. And Aubagio is a very safe and effective medicine, and it's being thought to be a good comparison. People can have relapsing MS or progressive MS with relapses and be in this trial. There is a very exciting first time in the region trial with primary progressive MS. This is not a blinded trial. Everybody gets treated. If someone has primary progressive MS, they have to have a positive spinal fluid to be in the trial. I'll have more details for you soon. But if you have primary progressive MS or you know somebody with primary progressive MS, let them know we have this trial available with a medicine that's already proven for primary progressive MS. It's not going to be on the market for a couple years, and they can get this medicine now. So if someone wants to be in research, they can call our office and ask for research. There's our main phone number with Advanced Neurosciences. They can email me at frontdesk@neurosci.us. As far as what's coming down the road for people with MS, there's two medicines. One's called ocrelizumab. The other or it may be Orevus or Ocrevus. They haven't decided what the name's going to be for sure yet. And this is an anti-CD20 B-cell depleter for relapsing or progressive MS. It unfortunately hasn't been submitted to the government for approval yet. It will probably be 6 to 12 months after it's submitted. The other exciting drug is one that's the first drug we've had for spasticity that's new in nearly 30 years. It's called Ontenua ER. It's an improved version of baclofen, and it is got much more benefit with much less side effects than the other drugs that are available. Well, this is meant to be a brief presentation, just get some information out there for people. We'll post this presentation on our website. You know, you can certainly, if you're interested in one of these trials, give me a call directly. Someone who's already in a research trial may not be eligible, but they can learn about these new medicines. The Ontenua is going to be available for everybody, hopefully by this fall, and basically people are probably going to need Xanadine and not done well with those to get it. But the other research opportunities we'd love to talk to people about. Are there any questions this evening? Look and see. All right, I'm glad you can hear me now. I'm sorry about the trouble we had with the audio earlier. All right. Anything else this evening? Any questions I can answer about MS for you? All right. Well, you take care. We're going to wind up things right now, and you know, email me if there's a question that I can help you with. Have a good evening. Thanks for coming.
Thank you.
Thank you.